Hi, this is Misty Carr. This is my submission for checkoff number 2 for NUR 326. I'm going to start with chapter 18, which is the thorax and lungs. I'm going to start by inspecting the thoracic cage, which is a 2:1 AP diameter, which is normal of a kid of an age of almost 7. Under 6, you can expect them to be a little bit barrel-chested as in their toddler and newborn years. Next, I'm going to count our respirations over a 1-minute time period, which I've already done with a respiration rate of 22. Sometimes if they're sleeping or you're just checking their respirations after medication, the respirations can be a little bit more shallow, so you can count those more easily by placing a hand over their chest and counting the respirations over a minute. Next, I'm going to inspect the chest wall for equal color. On our chest wall, there is no discoloration. There is no bluing or signs of cyanosis. There are also no lesions noted. Position, she is standing upright easily. Relaxed, her facial expression also shows she's a little relaxed. And next, I'm going to check her level of consciousness. What's your name?
Haley.
And where are you?
In my living room.
And how old are you?
6.
Can you tell me what holiday's coming up?
Halloween.
Okay. All right. Next, I'm going to start by palpating the chest wall. We're going to start by checking for symmetrical expansion, which I'm going to do by forming a V shape with my hands and placing them just under her sternal cage. And have her breathe in real deep. And back out. Another time. And out. My hands did move symmetrically, which is a sign of symmetrical chest expansion. I'm also going to palpate the chest wall. Does that hurt anywhere that I'm feeling?
No.
Okay, I also feel no masses or nodes or lumps, and she showed no signs of tenderness and no complaints of pain. Next, we're going to check tactile firmness, which you're going to repeat 99 for me.
99, 99, 99, 99, 99, 99, 99.
Okay. Of an adult, you're going to do those about 5 centimeters apart. With a child, you're not going to have to do as many, but you want to make sure you're doing those going back and forth from left to right or right to left across the chest, making sure that the noises are heard or felt bilaterally. Next, I'm going to percuss over her lung fields, which I'm going to have her turn around and face the back part of the wall for that. I'm going to place a hand over her chest and tap on it. Again, I'm going to go left to right, listening for any dulling of the sounds. Please stand up straight. There's no dulling or hyperresonance across your chest wall, and there is equal pitch. Next, I'm going to assess for equal breath sounds by listening both front and back. Okay. When I tell you, take big deep breaths, okay? Take it in and out, and in and out. You're going to want to do this going across the chest wall and across the back, going from left to right. Slow down. And you're also going to listen under the arms a little bit on each side to listen for any adventitious sounds of the breath sounds. All right, come around, turn around, and go across the front again. Listen good for equal inspiratory and expiratory lung sounds. Okay. Next, I'm going to listen for bronchophony, which I'm going to have her turn back around and face the wall. And repeat the number 99.
99, 99, 99, 99, 99.
Okay. Next, we're going to do the whisper pterygophony. We're going to whisper 1, 2, 3. That is heard equally, though very dull sounding throughout, and very faint because of her whispering. And the next we're going to listen for egophony, which we're going to have E-E-E. Say it out loud.
E-E-E, 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 E-E-E.
And that is also heard equally with no dulling or hyperresonance heard. There are also no adventitious lung sounds heard. Chapter 19 starts with the neck, and for this we're going to inspect the neck I'm going to start by palpating the carotid pulses. You're going to do this one side at a time. We're going to feel for a couple seconds on both sides. The pulses felt equally in strength. Does it hurt when I'm pushing?
No.
Okay. Alright, next I'm going to have her lay on the couch. Can you lay down for me? Put your head about right here. For this, it's gonna be mainly for adults, but you can also check in children. No, lay on your back for me. Okay. And tilt your head up. You're gonna feel for your external jugular vein, which pulses good in a kid. You're gonna hold a ruler up at the sternal wall, and you're gonna take a flat, even object. If you're in a hospital setting and not at home, you can typically use a tongue depressor and measure from the point where you felt the pulse across to your centimeter line, which is at 1 centimeter on her. You want to be less than 3 centimeters on an adult or child, which helps measure the likelihood of CHF. There's no jugular vein distension seeable or palpable. She is at 1 centimeter at a 30-degree angle. So there is a less likelihood and one less sign of CHF for this child. Go ahead and stand up for me. Next, I'm going to inspect her precordium, which is the front of her chest wall. I'm going to start by feeling for the apical pulse, which can be felt at the 4th and 5th intercostal space. I'm going to feel, and this sometimes is only palpable with a child or someone who's thin. I'm also going to auscultate for any thrills, lifts, or heaves. And there is no torturous sounds noted. Okay. I did. Next, I'm going to auscultate the heart sounds. I'm going to start, arms down please, with the aortic at the 2nd right intercostal space, the pulmonic, the 2nd intercostal space, Erb's point at the 3rd intercostal space, the tricuspid at the left up near the sternum, and then the mitral at the 5th further to the left side. I'm going to note the rate and rhythm, which is about 112 at this time, and equal rhythm. I'm also going to try to identify S1 and S2. S1 is heard louder at the apex of the heart, and S2 is heard louder at the base of the heart. I'm also going to listen during systole and diastole for any adventitious sounds, and there are no murmurs noted at this time. I'm going to repeat those sounds with the bell of my stethoscope over the aortic, the pulmonic, Erb's point, tricuspid, and mitral valves. I'm going to have her lay on her left lateral side. So go ahead and lay with your head right here and your feet down here, facing towards the camera. Lay on your side. Put your arm down in front of you to help support your weight so you're not all crunched up. There you go. And I'm going to listen for the apex of the heart to be closer to the chest wall, be a little louder. And when standing, the base of the heart is going to be a little louder sounds because the base of the heart's closer. Okay, go ahead and stand back up for me. Next is chapter 20, which is the peripheral vascular system. All right, go ahead and put your arms straight out to your sides for me. Here, I'm going to check the strength of the arms. Go ahead and push up. Push up. That is equal on both sides. I'm going to inspect color and size. This color is equal in pink. No signs of cyanosis on this. And the same on the other arm. The size is equal and there are no lesions noted. Next, I'm going to palpate the pulses, which is the radial and ulnar on both sides of the wrist. Haley, arms out. The brachial on the insides of the elbows. And then next I'm going to do the modified Allen test, which I'm going to have her hold her arm out like this. And I'm going to include both the radial and ulnar pulses till the hand begins to pale. When that happens, can you try to move your hand down? She has a hard time grasping and holding it. Okay, open here back up. The hand is extremely pale, and I'm going to release. unless the ulnar artery is occluded, the hand will pink back up. Go ahead. Next, I'm going to feel the epitrochlear node, which is right above the hip, which is a lymph node, and there is no masses or hard spots palpated. Next, I'm going to inspect the legs. I'm going to inspect the legs for equal size and color and shape, and her legs are equally in color. I'm going to measure both calves to make sure she's developing equally on side to side. This calf is at 9 inches, and this calf is at 9 inches. Next, I'm going to palpate for temperature of the legs, which her legs are equal tempered on both sides, and her feet. I'm also going to feel for the femoral pulse bilaterally. Go ahead and turn around. The popliteal pulse, which is felt bilaterally, and sometimes it's equal to feel if you haven't bent their knees. I'm going to try a manual compression test where I'm going to depress the popliteal pulse and check for the posterior tibial pulse, which is still felt, which is a good sign. And I'm also going to have her turn back around. On the inside of her legs, I'm going to feel for the posterior tibial pulses bilaterally and the dorsalis pedal pulses bilaterally, which are equal in strength and rhythm. There is no edema noted. And that concludes checkoff list number 2.